CIO is a very important appointment for me during the year. I would say the most important one because it is the place where to share knowledge even from colleagues with other disciplines.
The program committee put together an extremely exciting program, and everybody I think is looking forward after these 2 years of having no live Congress. So I'm really looking forward to the update of HCC. As well as colorectal cancer. So because there's a lot of things are going on in the also in the combination with the other disciplines, and we have to be informed and we have to update us about all these different options.
Of course, HCC will open the Congress with the first session, what you should know in 2022, following the new update of the BCLC algorithm. We will understand what's really new, what has stayed the same, what will come in the future.
The hepatocellular carcinoma session is really gathering the top experts in Europe, and not only Europe, of hepatocellular carcinoma. We will discuss about biopsies, about the role of transplantation and new criteria for transplantation, obviously TACE, but also ablation and how to improve ablation. We're going to touch on radioembolization, and finally, obviously, we cannot skip systemic therapies, which are completely different. So I hope it's going to be really interesting, and maybe some debate is ongoing.
In my lecture, we will discuss the past and the very current data on transcell therapies in intrahepatic cholangiocarcinoma and their impact in the treatment concepts right now.
In the mid-PI session, we had of course to select 5 or 6 studies focusing more or less on liver diseases. There is other study running now. One is very interesting, several studies are very interesting, is combining systemic treatment with interventional oncological procedure. And I believe it is the future, one of the largest future for interventional oncology.
For my lecture, I will focus on the brain and particularly in the skull base. I think this is a new indications, particularly in the skull base. We have cancer, we have no treatment anymore. It means those patients have no issue outside what we are doing. Those patients are coming from ENT surgeons usually. They have already surgery, they have radiotherapy, and then we are proposing them a new opening to do ablation to extend their survival and comfort for these patients, to having a better life, less pain, and better comfort.
I'm very happy to be able to speak about the link between cryotherapy and immunotherapy. And my presentation is it's called Cryomin. It's a clinical trial that wants to investigate the role of cryoablation in addition to immunotherapy for the treatment of bronchial adenocarcinoma, metastatic bronchial adenocarcinoma.
Many colleagues are not able, are even not allowed to attend a meeting right now, and therefore we have the excellent format of the hybrid meeting that is, thanks to our platform, extremely interactive.
We are so lucky to be here and so happy, and I think this will really be a great Congress with many people attending and sharing again in person feelings, impressions, and also looking for advice from colleagues and experts. So I'm really happy and looking forward to it.